they appreciate that.
Can the Brown, excuse me, can the Brown Berets as a group take action that will show this interest to younger people and get them engaged? How would you go about doing that? Look, I'm thinking in terms of social programs that might be fundable, that would allow this kind of thing to happen. How would the Brown Berets implement this kind of social program if you had the funding to do it? How are you implementing it even now without the funding?
I'm doing it. I put out my body in it. I'm trying to educate our kids. I give some workshops, like it's example, talk to them everything about Aztec identity, Chicano ideology, all this stuff. But I do it myself. Comes out of my pocket.
You go out to the schools. Do you go out as a Brown Beret, or do you go out as...
I don't go. They come to me. They looking for me.
Who comes looking for you?
Students. Some of those who I really want to know their identity.
So they come to you when they see you in the street, or they come to you when you're home? How do they come to you?
No, most of the time we do LUC for presentations. We talk about accountability. It is not accountability. We talk about the reasons. We talk about retaliation. We talk about non-military recruitment. We talk about curriculum instruction should be modified in order for educational reform to happen. We need to have a curriculum instruction with Chicano studies included in it. We don't want the Mexican-American history to be excluded. That's racist. It's not the question, especially when you study American history. It should be there. It should be there. And also we talk about school. We talk about 72,000 expulsions. We're talking about prevention, intervention, remediation programs, remote. So they see us and they comment. And sometimes I walk it, sometimes I go to a bakery. Oh, I saw you. Yes. And I give them my card. They call me. Then the mother called me, oh, my child got suspension. What can I do? And some kind of things like that. It takes more contact with the community. Contact with the community.
Well, it almost sounds as though you couldn't, there wouldn't be enough money in the world
I don't
to
have
pay,
enough money.
to pay for that kind of work.
Well, I'm planning, probably in the future, just try to reach, I spent we're trying to do lobby, and I'm planning to reach the state funding, or federal funding, to implement certain programs into this, under the umbrella of this organization.
One of the programs that we talked about in the first part of the session and that the Brown Berets had established were free clinics.
Yeah, something really needed. That's why a lot of kids are dropping out. They don't see well, they don't hear well, and obviously medical is like a lot of fraud in the medical system also. They just pass the card, they charge, but they don't give you the service. It's the same with the programs on LUZ. They can pay, a lot of personnel can pay, but they don't give the service to the children in school.
Well, one of the ways that we got the free clinic movement going in the 60s, and you know, I documented the first Brown Beret free clinic, was by forming partnerships with professional social action groups. When the first one started, it was a partnership between the Brown Berets, Psychologists for Social Action, and Physicians for Human Rights. And each did their part with the understanding that it would be run by a community board. So, in other words, each of the professional organizations took responsibility for recruiting others in their profession to come to work for free in the clinic certain days a week. But then the community board took responsibility for organizing, making sure there was a place finding the various kinds of equipment that was needed, getting donations of drugs, keeping records, all of these kinds of things the community board took on. And it was a partnership, and it was a real partnership, and very different from what a lot of the politicians are talking about as the solution to our healthcare crisis is a public-private partnership. When the private sector gets in, there's no partnership. There are executives who make $10, $20 million a year. There are administrators who make several $100,000 a year. And providers don't really get paid. And the consumer is lost in his tracks because providers don't get paid. Providers wind up having to go fee for service. And the whole thing is a big mess.
Yeah.
But
It's corruption like in everything.
the real way, I think, and you may have a better way now because times have changed, but the way we did it then was to have a partnership with the professional groups who were socially concerned. And there still are.
Hopefully.
There still are.
I'm trying to reach some teachers for certainly, because obviously as Chicano studies teachers we will do better training than me, yeah? Better explanation, better instruction. But most of the people don't have time for the youth if you don't pay them. In the schools, teachers cannot stay 5 minutes late because they're already writing grievance for the union. The unions become I'm talking about bureaucrat unions, teachers, UTLA and ALA. Those, they don't give you 5 minutes extra because they're already writing grievances. So you need people to accept these kids. You need professionals who love children, who really wants to be there, who really has visionaries, who see the future out of these hands of these kids. But it's not happening. A lot of them, I told you, they don't want to do nothing for free right now.
You know, Lorena,
I'm talking about certainly people which I didn't find it.
I know.
I'm not talking about for everybody. Because you can find some people who's retiring, probably thinking, so already retired, has a little bit of an extra.
you're reminding me of something that I ran into, which was the bitter truth. In 1974, in Portugal, there was a revolution. You're familiar with that. The armed forces movement made a revolution. And the torture centers were opened up, and thousands of Portuguese people who had been tortured for thinking politically, for acting or speaking politically, were released. I went there in my capacity as Amnesty International Medical Commission. Okay? But the point was that I had already been communicating with psychologists and psychiatrists there about the need to assess and treat these people. And their communication was very good. You know, they wanted to do that. I was quite willing to teach them. I didn't charge for it at all. I mean, that was my job. So I arrived in Portugal not long after the revolution, and I was lecturing at the medical faculty at the University of Lisbon. And I was talking about what happens to people who are tortured and, you know, what the consequences are, what kind of treatment they need, et cetera, et cetera. And I said, I'm here asking for volunteers. We've got 8,000 people who need treatment right now. You are medical students and medical faculty. Will you come forward? And of course, when the crowd, you know, they cheered and all that stuff. But the fact was that all of these medical professionals who were members of the Marxist-Leninist Party, when you asked them to come forward for free, said, I can't work for free. You know, you can't expect me to work for free. You get funding to pay us, and we'll work. Now that was Portugal. This is the United States. And we're talking about the same malaise, the same disease, right? So, the answer to it I wasn't able to apply it in Portugal myself, unfortunately. But what did happen in a number of places was that, again, health professionals banded together. Sometimes they got funding, sometimes they didn't, to treat torture victims from all over the world. And if you apply that lesson to here, it's going to be a matter of pulling these forces together. Your organizing skills will be tested to the limits because you're going to have to be able to talk to the people who are accustomed to focusing on their self-interest and make them recognize the social interest. And there's a lot of argument to be developed there.
Look, I'm gonna do the best I can, but also my health doesn't sometimes let me do that much. But I'm gonna try. I'm gonna die on the field, that's for sure. Because I see the system has been victimized my child. Now she's finished high school. I'm not gonna leave LSD alone. I'm gonna keep behind them because they mess with my child.
Okay, got some more to contribute to this conversation? Got some ideas about how to recruit, stimulate, and inspire?
It's hard.
A lot of the recruits that I've got are just the kids that we've helped. So we
That's
help
a
them
really
out,
good
and then
point.
they join, and then they tell their friends, and then one of their friends someday runs into a problem, and they'll say, "Hey, we'll call Anthony." So they call me, we help them out, and then the next thing you know, they're brown berets. So that's how we've done most of our recruitment. We've done the recruitment drives, and for some reason, the recruitment drive gets the word out into the community, and that's good. But actually getting recruits, I don't think I've ever got one single recruit
It's
out
hard
of a
because
recruitment drive.
right now,
Most of my recruits are just kids that I've helped on the street. Well, not me, but the organization.
this new generation, American children who work from parents who come from other countries, it's hard for them because they don't know much about Chicano history. And their identity is lost sometimes between confusion and then so many manipulations around the society where they live, where we live. And sometimes some parents were not high educated, so it's hard for us to.
Do you know why this surprises me? I know I shouldn't be surprised. But if you go into a bookstore now and you look for books on the Chicano, you find them. If you look at a curriculum at a college or university, you've got Chicano studies. So I'm surprised to hear that the message
parents
isn't coming
don't
across.
teach the kids at an early age
Well, that's
how to study or love to study. It is something you need to learn when you're in kindergarten. You know, my child, I teach her the ABCs. I work with her. Even what they were telling me, she would never learn. Okay, I don't give up. Look at, she learns. She knows what they told me. But my parents don't do that because number one, they could be busy working in 2 jobs, like slaves. It's a new way to be slaves in this society, minimum wage. Or are completely lost also. There's some parents who, okay, they come with different backgrounds. So a kid, when it's 2, 3 years old, 1 year old, 5, 6, they like a sponge. They got everything you teach them. If you don't teach them at an early age to study, to be disciplined, to be respectful, to respect, and study is a skill. You need to get it when you're little. If you don't learn it, you never get it before because it's something. It's very difficult to get discipline after you so well in discipline.
the point that your daughter brought up earlier during the speech was a lot of times instead of sending them for detention or dealing with it in some other constructive manner, they send the child home. Even at the elementary school level, they send them home for any little thing. For any disciplinary problem, they send the child home. The problem with that is that for every day that child is out of school, he falls behind. And he falls behind. By the time he gets to high school, they're lost. They're
They used
lost.
to come